Hey love, so welcome back. So I know I've been MIA for a little minute, and that's because I wanted to revamp my YouTube to where it's more catered to like lifestyle. So like things that go on throughout your life on a day-to-day basis, things that you may expect, some things that you may not expect. So this video is going to be just the processes and the steps and the doctor visits I had to go through when my pap smear came back abnormal. So let's get it started, and thanks again for watching. I know it's been a little minute, but I just want to update y'all on everything. So first things first, in January or February of last year, 2018, went for my regular checkup, and the doctor asked you, when was your last pap smear? And with me being in transition of movement, I thought about it. I was like, man, it's almost been like 2 to 3 years since I've had one. So, I've always had normal pap smears, so that was like nothing to worry about in my mind. So went, had all the little testings done, get a phone call about a week, 2 weeks later that it was abnormal. And they actually called me back to the office to tell me that they went through all like the test results, and just like, it did come up abnormal and I would take this real serious. That's what she told me. And go speak to the OBGYN or whatever. So I waited a whole year, you guys. Like, I panicked. I probably cried for like 2 months straight because that was just the most scariest thing ever. Like, what if I have cervical cancer? Because usually if like a test comes back abnormal or positive or something, then usually in the back of your head, like, you have something. So that was like very scary to me. So then in October, close to the end of this year, started having like a lot of abdominal pain. Started having a lot of abdominal pain, a lot of pressure, and I thought it was from like me drinking coffee and me, doing soda every day. So I cut that out, and the pain was still down there. So when it came time to have my annual, I was like, she went and she asked me like, hey, have you had your pap smear? Like, did you ever go back to get that checked? And you know me, I'm like, no, I was scared. Like, I didn't think that was nothing I really had to worry about at that time. And so she looked at the results again from last year, and she was like, no, you really need to go. So made the appointment with the gynecologist, and she basically told me it was HPV, but the HPV that leads to cervical cancer. My heart dropped. Like, I was like, is that curable? Like, how the hell do you get rid of HPV? Like, how the hell did this happen? It's my question. Like, she was like, no, it's nothing to panic about. About 90% of people get HPV. So I'm like, okay, cool. So everybody basically walked around with HPV or whatever. She was like, technically. I was like, so is there medicine? What do you do? And she was like, your body heals itself. So for some people, they might have it like 2 years straight, or it might come up positive on every test. So she was like, the best thing to do is just to redo the pap smear. So we redid the pap smear. Luckily, it came back normal this time. However, the steps I would have had to go through after finding out that it was an abnormal pap smear was to, one, they would do like a colposcopy, where they like stick, it's almost like a pap smear where they stick something in, and then I guess they use like little tweezers or something to pull like skin or cells off of your cervix and test it for that. And then they will move forward with the next steps. In regards to the abdominal, like lower abdominal pain I was having, I had to actually have an ultrasound for that. So I'm like, oh my gosh, like, what is going on? And so if you ever had abdominal pain, especially like around your cycle, and it's like very crucial, like very intense pain, she told me that was because your cervix, your ovaries, during the time when your cycle, like you're having your menstrual cycle, your ovaries gets hairs or something, and it creates little cysts. And so sometimes it's more intense around your cycle. So I'm like, And so the pain I was having was actually like cysts popping. And I'm like, this is the most uncomfortable pain ever. However, since all of those visits and taking care of that, being put on like ibuprofen for any time I have pain, I've also changed my diet. I'm in between pescatarian going vegan because I wanted to make sure, like, after that scare of almost having cervical cancer, I wanted to make sure I could prevent it to the best way I can. And I believe that's mainly with fruits, veggies, eating less processed foods. However, I did want to just bring up the thought of having cervical cancer. And it was almost, in my mind, it was like, I knew I would eventually have to, like, if I was diagnosed with cervical cancer, go through the radiation or go through whatever it is you have to do to get rid of it. But it wasn't, I was more prepared to do it alone than to have other people worrying about how I felt or what I was going through. Because I never want to, like, the people, like family, your close, your best friends, especially if they've already lost somebody to cancer. I didn't want them to have to worry about me. I was more worried about them. Like, I can do this myself. Like, I don't need anybody to just take care of me. So I think that's how a lot of people that have cancer or have had cancer, regardless of, them being cured or whatever it is, remission, I think it's more they want people to not feel bad for them, to actually continue living their life. Like, talk to them. Yeah, like, hey, how you doing? Like, just check in on them. It doesn't always have to be about whatever their diagnosis is. So, not going to tear up, but that was it. I just wanted to keep you guys updated on that because I feel like a lot of women may be scared when they get that abnormal pap smear. I know I was, and honestly, I've talked to like a few women who've actually been through the same thing and have actually had to have the colposcopy and that, come back negative. So it's not as scary. It is scary, but it's not as hard or difficult. It's just going through the steps, making those appointments. So I hope that helps. I'm free. Y'all can always message me, DM me, like me, comment, whatever, if you have any questions. I'm not a doctor, but I just thought that this was something that women go through that we honestly needed to talk about. And of course, like, subscribe, share. Thank you.